There's two lines coming from Republicans. One is we're going to cover everyone, we're going to expand coverage. That seems implausible. But the Paul Ryan is we're not going to win a beauty contest with Democrats. I'm quoting him on coverage, that this is about freedom and choice.
Freedom and choice? Freedom and choice to have a heart attack and not have any health care coverage? Freedom and choice to have a child with complex medical needs and not have any kind of health care coverage? Freedom and choice to need access to nursing home care and not have any way to pay for it? It is only the Republicans who can come up with this kind of doublespeak. There is nobody in America who thought that knocking millions of people off their health insurance was the way that we were going to improve health care in America. And let's be clear, because even after all these people are denied health care coverage, they're still going to get sick. They're still going to need help. And that means one of two things is going to happen. Either we're going to have community health centers that are not going to get reimbursed for the care that they give. We're going to have rural hospitals who are not going to get reimbursed. We're going to have hospitals, doctors, everyone in the healthcare profession is somehow going to have to absorb those losses and either pass along the cost to everyone else or find other ways to cut their care, or it's going to bankrupt families. That's the only way this goes. And that's the part that's so frustrating about this. Look, there are a lot of things we needed to do and still need to do to improve the Affordable Care Act. There are ways that we need to work to bring down the cost of health care for everyone. And we were working on those. We continue to work on those. There are things we can do. There are ways we can change the compensation system around it, for example. There are ways that we can make better investments in low-cost health care, like preventive health care, so that we don't have to pay as much at the back end on health care. But at the end of the day, it's about delivering health care services to hardworking people across this country. And if we fail to do that, then this is a serious economic blow to America's middle class. This is just a punch in the gut, saying, hey, more and more of you are on your own. That is wrong economically, and it is wrong morally.
I'm glad you spoke about patches to Obamacare, because one of the things that's happened, right, is that that conversation's been lost because of repeal and replace, right? So one of the arguments that Republicans in the White House make that seem to me arguments that Democrats should take seriously is this choice question in a third of U.S. counties, right, that are down to one insurer in that county. You see a real kind of geographic divergence of how well the system's working. It's working fairly well in Massachusetts. It's working in a lot of states, particularly with expanded Medicaid. A lot of places like Arizona, it's not. What is the solution? If the Republicans didn't exist, if you, Elizabeth Warren, and your colleagues could say, here's what we want to do, what does that look like?
So I want to do exactly what we did in Massachusetts. And that is, we passed our initial law back in 2006 with the aim of having both universal coverage and in driving down the cost of health care. We just looked at the numbers and said, we got to do this. But here's the key. We kept adjusting. We kept adjusting how we did payment. We kept adjusting how we did Medicaid. And then when the Affordable Care Act came along, we didn't just say, oh, that's okay, we've already fixed this problem. We said, wait a minute, there are new opportunities here. There are new obligations here. We want to integrate this. And that's what we've done. Healthcare is not something you can come in, you can write one law and say, okay, we're now done with this, unless your idea of healthcare is let's just knock people out and not give them the coverage that they need. It's something you got to work on. And you got to keep dialing in on the pieces. As it gets better, you need to make it even better.
So I've noticed something, and I'm curious because you work with these individuals. So two people that have been very prominent critics of the House bill are Tom Cotton and Rand Paul. And I can't help but notice, now they've been attacking it from the right, okay? But I can't help but notice that these are two states that did expand Medicaid, Arkansas in a kind of somewhat strange way, the private option it's called, Kentucky in a more straightforward way. But they have really driven down the rules. I mean, how much do you think was driving those two individuals, their ideological disposition aside, the fact that their own constituents would take it on the nose?
In other words, are you asking how much is reality?
Right.
Now sticking its nose into the ideology here? And the answer is a lot. There are a lot of people in Arkansas, a lot of people in Kentucky who say, wait a minute, it may not be perfect, but boy, this is a lot better than what I didn't have before. This is a lot better than a system where I could be thrown out for pre-existing conditions. This is a lot better than when I didn't have some help getting health insurance. Again, the measure is not, is it perfect? No, it's not perfect. That's what we got to keep working on. The measure is, are we moving it in the right direction? And I think both Cotton and Paul are making an admission, yeah, the Affordable Care Act moves us in the right direction.